Hi, my name is Candace Pfeiffer. I'm an occupational therapy student at St. Augustine. What is your name and date of birth?
Maddie Lindbergh, January 10th, 2003.
Very good. Do you have a second form of ID? Thank you. Today we will be measuring range of motion and manual muscle tests on knee flexion and extension. Do you have any surgeries, medications, pain I should be aware of?
Nope.
Okay. Do I have your consent to proceed?
Yep.
Very good. So we will start with knee flexion. I want you to go ahead and just bring this knee all the way to the ceiling, bringing the bottom of your foot almost to your bum. Very good. That's active range of motion. Go ahead and place it down for me, please. Now I'll perform passive range of motion. All right. Okay, and that is a springy and feel. Very good. And now I'll go ahead and measure. I'll palpate for the lateral epicondyle of your femur, which is right here. And I will place the stationary arm in line with your femur and movable arm in midline with your fibula. Okay, so I want you to go ahead and perform that movement for me, please. Go ahead and flex your knee. Very good. Now go ahead and find that lateral epicondyle right there. Okay, so you are measuring from 0 to 130. And that is within normal range of motion of 0 to 135 degrees. And your occupations would be putting your pants on when you are going to put your foot in and climbing up the stairs. All right, now we will be performing manual muscle tests for knee flexion. I'll have you go ahead and perform the active range of motion. Bring your foot to the back of your bum, please. Very good. I'll go ahead and grade you a 3 out of 5 on the manual muscle test for that since you performed the full range of motion. I will go ahead and perform passive range of motion. Very good. And if you were not able to complete that, we would lay you on your side and have your knee on the table, and then I would have you go ahead and flex. So now I want you to start in mid-range. I'll stabilize right in the back of your thigh, and then I'll place resistance right above your ankle. So please resist me. Starting now. Very good. You withheld my max resistance, so I'll go ahead and grade you a 5 out of 5 on the manual muscle test for that. The prime movers are the semitendinosus, semimembranous, and the biceps femoris. And you can continue to climb up and down the stairs and put on your shoes in the morning. Hi, and for knee extension, I would also have you in a supine position, and your range of motion would just be flipped, so it'd be 130 to 0, and that's a hard end feel with the prime movers of the rectus femoris, the vastus lateralis, medialis, and the intermedialis. Excuse me, the intermedius. Now we'll go ahead and perform manual muscle tests for the knee extension. I'll have you sitting for me with a towel under your knee. I'll have you go ahead and extend. Very good. Okay, and now that was active, I'll perform passive. Okay, and that's a 3 out of 5 on the manual muscle test since you completed the full range of motion. Now I'll have you go ahead and start in mid-range. I will stabilize right above the knee with the towel under supporting you, and I will resist right above your ankle, so please resist me. All right, since you did not withhold my max resistance, I'm gonna grade you a 4+ because it was almost there. Your prime movers for that, I stated in the last video, and your occupations would be shaving in the shower. Next, we will be measuring your ankle plantar flexion, and I have you in supine position with your ankle hanging off of the table. I'll have you go ahead and perform active range of motion. I'll have you start in mid-range and then perform the active range of motion. Put your toes to the ground. Very good. Okay, and now I will perform passive range of motion right here. Very good. And that is a springy end feel. Now I'll go ahead and palpate for your lateral malleolus, and that'll be where the axis goes. I will place that there, and then your stationary arm will be in midline with your fibula, and then your movable arm will be in midline with your hind foot. So I'll have you go ahead and start in mid-range, please. Okay. about 50. Very good. There we go. See that? Okay. Now I'll have you go ahead and perform that active range of motion. So 50 to about 20. So you're measuring from 0 to 30 degrees, which is not within normal range of motion, but is functional. Well, the normal range of motion is 0 to 50, but you are functional measuring 0 to 30. Next, we will perform manual muscle tests for the plantar flexion. I'll have you go ahead and start mid-range for me on this foot, okay? And I'll have you go ahead and flex that plantar flexion for me, please. Bring your toes out, okay? That's active range of motion. I'll do passive range of motion, okay? And that's a springy and feel. And I'll grade you a 3 out of 5 on the manual muscle test for that, since you can perform full range of motion. Now I'll go ahead and have you start, in mid-range just like this. I'll stabilize right above your ankle and place resistance between the balls of your foot. So please resist me, okay? Perfect. So I'll grade you a 5 out of 5 on the manual muscle test for that. Since you withheld my max resistance, and the prime movers for that is the gastrocnemius, the soleus, and the tibialis posterior. And your occupations for that can be when you are putting your socks on. You can flex just like that. Stick them in there. Next, we will be performing range of motion tests for your dorsal ankle flexion, and I'm going to have you in supine position with your ankles hanging off the table, and then I'll have you go ahead and perform the active range of motion. I want you to start in mid-range and just bring your toes up. Perfect. Active range of motion, and then I'll perform passive range of motion. Okay, and that's a springy and feel. Very good. And now I'll go ahead and measure. I'll palpate for the malleolus, the lateral malleolus, and then I'll place my axis there with the stationary arm in midline with your fibula, and movable arm in midline with your hind foot. 50 minus 25. So you're setting your range is 0 to 25 degrees, which is a little bit over normal range of motion between 0 to 20 degrees. And we will go ahead and perform manual muscle tests for that. So I'll have you go ahead and perform active range of motion. Just start in mid-range, bring your toes to your tibia. Very good. And that's active range of motion. Now I'll perform passive range of motion. Stabilize your ankle and bring your foot up. Okay, and that's a springy and feel. Now I'll grade you a 3 out of 5 on that, since you can perform a full range of motion. And now I will go ahead and place some force. So I'll have you start in mid-range. Please resist my force, okay? And go ahead, flex up. This is mid-range. Very good. And begin. 1 Mississippi toes. Very good. Okay. Since you withheld my max resistance, I'll go ahead and grade you a 5 out of 5 on that. And your prime movers is your tibialis anterior, your extensor hallucis longus, and your extensor digitorum longus. With the prime movers, and the occupation would be clipping your toenails. If you're clipping your toenails, you can get a good cut when you flex this ankle up. Next, we will be performing range of motion measurement on ankle inversion. I'll have the patient laying in prone position on their stomach, and I'll have you perform passive range of motion, start in mid-range, and then I want you to we're doing inversion, so I'll have you bring your big toe all the way up to the ceiling. Good job. Very good. And that's active range of motion. Now I'll perform passive range of motion. Okay, and that's a firm, hard, and feel. Very good. The superior angle of your cancellus, which is right here. Okay. I'll have you go ahead and perform that active range of motion for me, please. Very good. Okay, and you are measuring 0 to 20 degrees, which is functional range of motion, but not normal, of 0 to 35 degrees. And your occupation for that is you can clip your toenails. We will be performing ankle inversion MMT, so I'll go ahead and have you perform active range of motion. Bring your toe to the ceiling for me, please. Okay, that's active. Now I'll perform passive range of motion. That's a firm, hard end feel. And I'll grade you a 3 out of 5 on the manual muscle test for that. Have you go ahead and start mid-range. And I will place force right here, and I'll place stabilization right in line with your calf. So please resist me. Very good. I'll go ahead and grade you a 5 out of 5 on the manual muscle test for that with the prime movers of the tibialis anterior and posterior. And your occupation would be putting on your socks and cutting your toenails. Next, we will be performing ankle eversion, and I'll have you go ahead and perform active range of motion. I just want you to bring your foot all the way out to the left side of your body. Very good. Now I'll perform passive range of motion. Okay, stabilizing right above your ankle. Okay, that's a firm, hard end feel. Go ahead and palpate for your superior part of your calcaneus, which is right here, and your axis will go in midline with your tibia. Stationary arm will go there, and your movable arm will go in midline with your calcaneus. So I'll have you go ahead and perform that range of motion. Very good. Okay, and you are measuring between 0 and 20 degrees, which is a little bit over normal range of motion of 0 to 15 degrees. And your occupations could also be putting on your socks. Next, we will be testing ankle eversion. I'll have the patient in a prone position with Italis stabilization. I'll have you go ahead and perform active range of motion. Starting mid-range, bring your pinky to the ceiling. Okay, that's active range of motion. I'll perform passive range of motion. Okay, that's a firm, hard end feel. And I'll also grade you a 3 out of 5 on the manual muscle test for that since you performed full range of motion. Now I'll have you go ahead and start in mid-range, and I will apply pressure or force. Please do not let me push your ankle down with the stabilization right above your ankle on your calf, okay? Very good. You withheld my max resistance, so I'll grade you a 5 out of 5 on that. And your prime movers is the fibularis longus and the fibularis brevis, with the occupations of transitioning your foot when you're driving from the brakes to the gas.